If you're feeling more tired than you used to, putting on weight mainly around your belly, and your doctor keeps telling you your labs look fine, there's something important I want you to know. You could have fatty liver right now and not realize it. Most people with fatty liver don't have sharp pain or dramatic symptoms. Instead, they notice things they chalk up to just getting older, low energy, a stubborn waistline, feeling extra sleepy after meals. Meanwhile, the liver can slowly fill with fat, become inflamed, and quietly move toward permanent damage. The good news is, if you catch it early, fatty liver is often reversible. The danger is letting it progress in silence until it reaches serious scarring, fibrosis, or cirrhosis, where damage may no longer be reversible, and words like liver transplant enter the picture. I'm a U.S.-based doctor who works with adults over 55, and on this channel we focus on metabolic health, belly fat after 60, and calm, science-backed ways to age better without crash diets or scare tactics. You may hear doctors now use the term MASLD, metabolic dysfunction, associated steatotic liver disease, instead of NAFLD. In simple terms, it means your liver is storing too much fat because your metabolism is under strain. Insulin resistance, high blood sugar, high triglycerides, belly fat, or high blood pressure. Today, about 1 in 4 adults has some degree of fatty liver, and in people with obesity or type 2 diabetes, that number can climb toward 80–90%. So if you carry most of your weight in your midsection, have prediabetes or diabetes, or struggle with cholesterol or triglycerides, this video is especially for you. Here's what we're going to cover together. 3 subtle, real-life warning signs in your body that most people ignore. The blood tests that quietly hint at fatty liver long before an ultrasound is ordered. What healthy normal really looks like for your age, not just whatever the lab slip prints. How to put it all together so you know when it's time to talk to your doctor. You don't need to memorize medical terms or fix everything overnight. My goal is simple. By the end of this video, you'll have a clear picture of what might be happening inside your liver and know the exact questions to ask so you can act early, calmly, and confidently. Let's start with those early, easy-to-miss warning signs that your liver may be struggling, especially the ones you might already be blaming on just getting older. 1. Persistent fatigue, when your power plant is struggling. Most people over 55 know what a tired day feels like, but the kind of fatigue linked to fatty liver is often deeper and more constant. You might wake up already tired, even after what should be enough sleep. Find simple tasks, climbing stairs, grocery shopping, tidying the house feel heavier than they used to. Feel like your body is shutting down after meals instead of being refueled. Your liver is like a 24/7 power station. Every time you eat it, stores extra sugar as glycogen, your backup battery. Releases that stored energy between meals and at night so your body can keep running smoothly. When the liver is overloaded with fat and inflamed, that system doesn't work as well. You might be eating enough, sometimes more than enough, but your body isn't handling that fuel properly. So you can end up in this strange situation. I'm eating, but I still feel exhausted. On top of that, fatty liver is tightly linked to insulin resistance. Your cells don't respond to insulin as well, so your blood sugar is more likely to swing up and down. Those swings can make you sleepy after meals, foggy in the afternoon, irritable if you go too long without eating. If you're thinking, I'm always tired, and it's not just one bad night, it's week after week, and you also have diabetes, prediabetes, or extra weight around your middle, that fatigue is worth paying attention to. Fatigue can come from many causes: sleep apnea, thyroid problems, anemia, depression, medications, and more. But when that deep tiredness shows up together with belly weight, high triglycerides, or abnormal liver enzymes, fatty liver moves much higher on the list of possibilities. 2. Stubborn belly fat, not just a cosmetic issue. The second big warning sign is weight that seems to settle mostly around your middle, your waistline, upper abdomen, and spare tire area, even if the number on the scale hasn't changed that much. This is called visceral fat, It wraps around organs like your liver, stomach, intestines, and pancreas. It's more dangerous than the softer fat you can pinch on your hips or thighs. This visceral fat doesn't just sit there quietly. It behaves like a very active organ that sends fatty acids straight to the liver, releases inflammatory chemicals like cytokines and TNF-alpha that irritate liver cells, worsens insulin resistance, which then causes more fat to be stored in the liver. Over the years, you may have noticed, your belt notch keeps moving outward. Your shirts feel tighter around the midsection. Your arms and legs haven't changed as much as your belly. That pattern is a red flag not just for appearance, but for both liver and heart health. Many patients tell me, "Doctor, I gained this belly even though I didn't really change how I eat." That's very common. As we age, hormones shift. Muscle mass tends to decrease, and we often move less. All of that makes it easier to store fat around the organs. Add modern high-sugar, ultra-processed foods, and the liver gets overwhelmed even faster. Here's the key loop. More belly fat, more fat delivered to the liver. More fat in the liver, more insulin resistance. More insulin resistance, even easier to gain more belly fat. The cycle feeds on itself. The hopeful part is that the reverse is also true. When you start improving just one part of that loop, better food quality, more walking, losing even 5–7% of your body weight, you often see improvements in both belly fat and liver health. Major medical centers like Mayo Clinic emphasize that even modest weight loss, single-digit percentages, not getting skinny, can significantly reduce liver fat in many people. 3. A dull ache or fullness in the upper right side. The third sign is more classic, but it's still easy to ignore or blame on something else. A mild ache, pressure, or fullness in the upper right part of your abdomen, just under your rib cage where your liver sits. Doctors call an enlarged liver hepatomegaly. In fatty liver disease, the liver often enlarges because of fat infiltrating liver cells. Inflammation causing swelling. You might notice a dull ache after heavy meals. A vague full sensation on the right side when you lie on that side. Occasional discomfort when you bend or twist. This is usually not a sharp, stabbing pain. Many people describe it as, "Something just doesn't feel quite right here." By itself, that feeling can be hard to interpret. It might come from muscles, ribs, the gallbladder, or the intestines. But when that right-sided fullness shows up together with persistent fatigue and stubborn belly fat, especially in someone with diabetes, high triglycerides, or weight issues, it becomes an important clue. The encouraging part is this. When fatty liver is caught early and you start making changes, that enlarged inflamed liver can often shrink back toward a healthier size. Many people notice that dull pressure fade as their lifestyle improves and their labs get better. 4. The liver enzymes on your lab report, ALT. Now let's talk about what your blood work might already be trying to tell you. On most routine blood panels, there's a section called Liver Function Tests. Two of the main numbers there are ALT, alanine aminotransferase, AST, aspartate aminotransferase. You don't need to remember the names. Just think of ALT and AST as stress signals from your liver. When your liver cells are healthy, these enzymes tend to stay in a lower range. When the liver is irritated, inflamed, or overloaded with fat, more of these enzymes leak into the bloodstream, and their levels on your labs start to rise. The normal range problem. This is where a lot of fatty liver risk gets missed. On your lab report, you might see ALT 3.8 normal range, 0.40. Your doctor glances at it and says, "You're in the normal range, nothing to worry about." But here's the catch. The normal range is usually created by looking at a big group of people and taking the middle slice of their results. Over the last few decades, as more people have developed fatty liver and metabolic problems, that average slice has gotten less healthy. Years ago, many labs considered an ALT around 25 as the upper healthy limit. Today, it's common to see upper limits around 35–40. So someone with an ALT of 37 might be labeled normal now, even though that same number might have been considered abnormal when the overall population was healthier. Many liver and metabolic specialists now use stricter cutoffs, especially if you're at risk for fatty liver. In everyday terms, that often means, for many adult men, aiming for ALT in the low 30 seconds or below, ideally in the 20 seconds. For many adult women, aiming for ALT in the 20 seconds or lower. You don't have to chase a perfect number, but a simple rule of thumb is, if your ALT is near the top of the normal range or slightly above it, and you also have belly fat, diabetes, or high triglycerides, that's a yellow flag worth discussing. AST can also be helpful, but for fatty liver, ALT is often more specific. If both are elevated, that deserves even closer attention. A simple example. Imagine your labs show 3.6 lab says normal up to 40. 3.0 lab says normal up to around 35. Triglycerides 2.10 high. HDL, good cholesterol. You're told your liver enzymes are normal, but you're tired. Your waistline has grown, and you have pre-diabetes. In that situation, I would not shrug and walk away. I'd be thinking, this liver might be under more stress than the lab range suggests. We should consider fatty liver and look deeper. 5. Uric acid, not just about gout. The next blood test I encourage many of my patients to pay attention to is uric acid. Most people hear uric acid and think of gout, that painful arthritis in the big toe or other joints. And yes, high uric acid can cause gout. But in the last decade, research has also linked elevated uric acid with fatty liver, high blood pressure, insulin resistance and metabolic syndrome, kidney strain. In simple terms, uric acid tends to rise in the same environment where fatty liver grows. Too much sugar, especially fructose from sugary drinks and processed foods. Too many ultra-processed carbs. Too little physical activity. Excess weight and belly fat. On many lab reports, you'll see a normal uric acid range that goes up to around 7. But for better metabolic health, many specialists like to see it lower. A practical target many doctors use in metabolic and heart health clinics is try to keep uric acid below about 5.5 if possible, especially if you have high blood pressure, fatty liver risk, or kidney concerns. Again, this isn't about diagnosing yourself, it's a conversation starter. If your uric acid is 6.8, the lab may call it normal. But if you also have belly fat, fatigue, high triglycerides, and a borderline ALT, that uric acid becomes another piece of evidence that your metabolism and liver may be under strain. The positive side. Uric acid can often be improved by cutting back on sugary drinks and sweets, reducing alcohol, especially beer and high fructose mixed drinks, losing even a small amount of weight, staying well hydrated, and eating more whole, fiber-rich foods. 6. Homocysteine, a subtle but important marker. Another lab that's not always ordered, but can be very useful, is homocysteine. Homocysteine is a type of amino acid, a building block of protein that circulates in your blood. Your body uses vitamins like B6, B12, and folate to process it properly. When homocysteine levels are too high, research has linked that to higher risk of cardiovascular disease, possible increases in dementia risk, and, in some large studies, a higher likelihood of fatty liver. A high homocysteine level doesn't prove you have fatty liver, but, like uric acid, it's part of the overall picture of how stressed or balanced your metabolism is. If your homocysteine is high, your doctor might check your B12, folate, and other related levels. Look more closely at your heart, brain, and liver risk. Recommend dietary changes or supplements if appropriate. For many adults over 55, especially those with diabetes, cholesterol issues, or a strong family history of heart disease, homocysteine is worth asking about. 7. When these labs are off, what to ask your doctor. So what should you do if You're feeling persistently tired. You're carrying more belly fat than before. You sometimes feel a dull fullness on the upper right side. And at the same time, your ALT is near the top of normal or slightly elevated. Your uric acid or homocysteine is higher than ideal. Your triglycerides are high or your HDL is low. First, don't panic. Second, don't ignore it. Here are reasonable next steps to discuss with your doctor. 1. Ask for a closer look at your labs. Try questions like, can we look at my liver enzymes, uric acid, and triglycerides together and talk about fatty liver risk? Even though these are normal, are they ideal for me, given my age and health history? 2. Consider additional blood tests. Your doctor might order fasting insulin, not just glucose or A1C, to see how hard your body is working to keep blood sugar in range. A more detailed lipid panel, sometimes including ApoB or other markers. Other liver-related labs if needed. 3. Ask about imaging if your risk seems high. Common tests include abdominal ultrasound, often the first imaging test to look for fatty liver. Fibroscan, a specialized ultrasound that measures liver stiffness and can hint at scarring or more advanced disease. In certain cases, more advanced scans or even a biopsy, usually only if there's significant concern. You don't have to march in with a list of demands. Just let your doctor know, I'm concerned about fatty liver because of my symptoms and these lab patterns. I'd like to make sure we're not missing early disease. A good doctor will appreciate that you're engaged and proactive. If you've listened this far and recognized yourself in some of these patterns, I want you to hear this clearly. You have not failed. You are not too old to make a difference. And you are not stuck with a silently worsening liver. You may not be able to change everything overnight, but you can. Ask for your lab results and review them with new eyes. Have a more informed, honest conversation with your doctor. Take 1 or 2 small, specific steps this month. Check back on your labs in a few months and look for direction, not perfection. Your liver is an incredibly resilient organ. In many cases, when you reduce the ongoing insults, extra sugar, heavy processed foods, excess alcohol, long periods of sitting, and add more movement, better sleep, and a whole food-based diet, the liver responds. Fat can decrease, inflammation can calm down, and scarring can often be prevented. You can't stop time from moving forward, but you can absolutely influence how your liver, heart, and brain age along the way. So ask yourself, which one small step from this video will I start this week? Looking up your last lab results? Taking a 10-minute walk after dinner? Switching one sugary drink to water or tea? Scheduling an appointment to talk to your doctor about fatty liver?
If this video helped you understand your body a little better and you want more calm, science-based guidance for life after 60,
I'd love for you to stay connected.
If this was helpful, subscribe for more trusted, science-backed health secrets designed especially for you after 55.
So you can protect your liver, your energy, and your independence for years to come.